Hello, once again, everybody, and welcome to today's Client Enrichment Series session, Water Quality Management in GSA Facilities, a Fall Update. My name is Eric Fulton, and I am the National Program Manager for Customer Communication and Outreach in the PBS Office of Portfolio Management and Customer Engagement, and I will be your host for today's session. So as the title suggests, this is an update on the continuing progress of GSA's water quality management program and baseline testing in our facilities. Before we jump into introductions and today's agenda, a couple of more housekeeping items. First, we have automatically muted the audio on everybody's end but our presenters, and that is to allow us to better control the sound quality of today's presentation. Part of our presentation today will be a Q&A with questions from you for our subject matter experts. We know you have questions. We have received some in advance already, and we encourage you to submit others through the Q&A pod below. You'll see that in your Zoom menu at the bottom of your screen. We will get to as many as we can. I will caution you, we do receive some specific and some technical questions, so we will most likely not get to all questions during the conversation today. But what we will do is compile and review all the questions we do receive, those asked, those unasked, and we will use them to inform future presentations, and we will provide updated information on our website, which we will go into detail about a little later today. A reminder, if you have questions about a specific building or an agency portfolio, I would suggest you contact the appropriate facility manager or your national customer lead to address those specific questions that you have. If you do have any administrative or technical issues during the course of today's presentation, just ask that question in the chat pod, which is different than the Q&A pod. We have our CES team members monitoring that, and they can assist you. So just once again, if you have a subject matter or water quality question, please put it in the Q&A pod. If you have a technical issue with today's presentation, just pop that into the chat pod below. Okay. So we are going to move on to the next slide here, and we are going to meet our presenters today. Oh, that is the agenda slide, and that's okay. You know what? I will read the agenda slide, and then we will introduce today's participants, because as you can see, or if you can't, I will tell you that introductions is number one on that list. So after we introduce today's participants, we are going to jump into a program update on our baseline water testing. And then we are going to follow that with some updates and revisions to our response actions. We'll pause there for Q&A. Feel like we'll have a good opportunity for that at that point. Next, we will jump into some resources that we have. Hopefully, you're familiar with our website. If you're not, you're going to get reintroduced to it today with some important updates that we put onto it. We have a video that we are going to share with you. Maybe you've seen it on our website, but it's pretty new. So perhaps this is the first time. We're happy to share that with you today. Talk about next steps, and then we will round out the conversation with more Q&A as our time and expertise permits. All right, so now we can move on and we can meet the members of our team today. I think we can jump one slide over there. They are. Hello, everybody. So as you can see, we have some folks with us from our Office of Facilities Management here in the Public Building Service, and we have some industry experts from the Special Pathogens Lab with us. So first, let's please welcome Courtney Springer. Courtney's the Assistant Commissioner, Office of Facilities Management. And Courtney came to GSA's central office from our Heartland region, where he held roles in many operational offices, including acquisition and property development for large construction projects and in facilities management. After holding an acting role in central office as the Deputy Assistant Commissioner of Acquisition in 2020, Courtney took on his current role in 2023 and now has facilities management oversight of over 8,600 federal-owned and leased facilities in the GSA portfolio. We also have with us Courtney Hatchell, Water Quality Management Program Manager, as well as the Senior Advisor to the PBS Office of Facilities Management, where she oversees the execution of our Water Quality Management Initiative and baseline testing effort. Prior to coming to central office, she spent her first 14 years of GSA career in several facility management roles in GSA's Great Lakes region. Also with us from GSA is Brad Short. He is our Acting Director of Risk Management. He's also a certified industrial hygienist and a licensed professional engineer. Like Courtney, he comes to us from GSA's Great Lakes region before he jumped over to the central office team. And so now in this role, he spearheads strategic initiatives and coordinates nationwide programs aimed at enhancing standards and promoting environmental health and safety best practices across diverse program areas. We also have two very special guest speakers with us today from the Special Pathogens Laboratory. First, we have Dr. Janet Stout, who's an infectious disease microbiologist. So Dr. Stout is also the founder and executive vice president of the Special Pathogens Laboratory. That's our expert consultant on the topic of water quality. She's a clinical and environmental microbiologist. Dr. Stout is internationally recognized for 40 years of research on Legionella. It's the bacteria that causes Legionnaire's disease. It's an authoritative source of information on the prevention, detection, and control of Legionnaire's disease. Dr. Stout was instrumental in developing the first U.S. prevention strategy for hospital-acquired Legionnaire's disease, and that now serves as the model for national Legionella guidelines to this day. Finally, we have with us Dr. Abraham Cullum, Director of Water Safety and Management, also with Special Pathogens Laboratory. Dr. Cullum joined the staff of the lab after earning a PhD in civil engineering from Virginia Tech. During his academic journey, Dr. Cullum was awarded the coveted National Science Foundation Graduate Research Fellowship, as well as a fellowship to perform research at the prestigious KWR Water Research Institute. That's in the Netherlands. So his peer-reviewed research has elucidated the impact of in-building plumbing environment on important opportunistic pathogens, antibiotic resistance, and microbial ecology. So I want to welcome all of our esteemed presenters today, and we're going to jump on over to the next slide. I'm going to turn it on over to the first person I mentioned today, and that is our Assistant Commissioner for Facilities Management, Courtney Springer. So Courtney, welcome, and the floor is yours.
Eric, thank you so much for the introductions. Really excited to talk to you today, not just about how we're going to test, but now what our test results are showing. So we've had the opportunity to do a lot of our testing. On this slide, I want to go through some of the facts so you're aware of where we are today. I also want to take the opportunity to remind you, if you would like to see where we are testing at your agency, you can always go to the Water Quality Management dashboard under the Customer PBS dashboard and see what your results are for your agency. So we break this up into our owned, leased, and owned delegated, leased delegated, and U.S. Post Office. Go through these real quick. On the far right of your, on the far left of your screen, you'll see the total number of buildings we're testing. So in presentations prior, we talked about the fact that we'll be looking at about 1,149 owned buildings, 102 delegated buildings, 6,101 leased facilities, leased delegated 26 facilities, U.S. Postal Service facilities 30, for a total of 7,408. We're well along our way in testing. So you see the percentage complete that's listed there for all the various different building types. You'll see that we're 54% complete on our owned. You will notice that we have many more scheduled. We have almost every facility currently scheduled. We're working diligently to get through all of our own facilities by the end of the year. We're also working diligently to get through all of our leased facilities by the end of the year. Our focus on the leased facilities, as you recall, we're doing those all through ULAs. We have had several lessors who have not responded yet. So in our efforts to get this completed by the end of the year, that's going to mean some of those that haven't been scheduled yet are going to be completed by us. GSA will go in, we'll use the same scope of work that we've been issuing under the ULAs, and if the lessor chooses not to complete the work, we will complete the work for them. As you can see on the results, I want to focus on that for a minute, and if you guys would click one more point on the slide, a number gets circled there. Since our last discussion, this number has come down considerably. A couple of factors lead into that. So this is the percentage of positivity on Legionella results. Before, that number was in the upper 60s. We've seen a couple things. As we've gone across the country, we've got more of a variety of testing that's been completed. So some geographic locations were having higher test results than others. So now you're seeing more of a blended number from across the country. Another thing is when we have an exceedance, we have a requirement in our contract to be notified immediately from the lab. So we can notify you and take our next steps. On those that don't have exceedances, those results take a little bit more time to come back. So when you see that we have 1,076 scheduled and we've received results for 619, some of those already have results. We just haven't got the official lab statements back on those without exceedances. If we click one more time, I just want to highlight where we see the total number that we have scheduled on the least, and then it points over, if we click one more time, to the total number of leased. So just want to make sure everybody's able to read and understand this chart. We're diligently working through these. We're working on the own to have them all scheduled by the end of the year, as well as the least. On those that the lessors are not taking action on, we will take the action. A couple things I just want to hit overall on what we found. We found different findings in every single building. A lot of people say, "Oh, everything's all the same," and it's not. This is very individual per building. We've seen different things. We do see reoccurring themes. So as we're doing this testing, we're working to do a number of things. First of all, we're working to resolve the exceedances. Any exceedances that we find, we're going in, we're looking for patterns, we're looking if there's multiple exceedances in drinking fountains or in other outlets. We're looking at those fixtures and understanding why there's exceedances. If we're seeing exceedances on the hot water side, we're looking into the hot water tanks to make sure temperatures are right. So we've seen a lot of those patterns. Brad Short, who's going to be talking to you shortly, has taken those and gotten them out as technical guidance to the regions. So when they're getting in their results, they know what to look at and how to manage water quality in their facilities. We've noted that the test results have required us to make changes in our facilities. Sometimes those are just operational changes. Maybe we need to do more flushing of the facility. Maybe we need to change the temperatures on our hot water tanks. Those are some of the operational things we've done. Sometimes we've seen that we need to make mechanical changes. In some instances, we found that we need to eliminate what we refer to as a dead leg, which is a long stretch of pipe that doesn't have an outlet at the end of it, or change some of the plumbing distribution system. We've got those very clearly identified. The regions, we meet with them weekly to talk through any kind of concern they have on the technical side, and we're actively working with them to make sure that they are clearly understanding and able to identify which steps they need to take to assure water quality in the facilities. Longer term, some of these buildings are going to require plans. In the past, you've heard us talk about 188 plans and 514 plans. Those are plans that are made available, the 188 under ASHRAE, which ensures long-term water quality. We're working to solidify those actions and facilities that will need those plans, and we're actively working to maintain water quality, not just at this point in time, but long-term. One last thing I want to hit before I turn it over to Brad is most recently EPA has reached out to us. EPA is responsible for managing water quality to the point of the facility. They've reached out to us and asked that we partner with them to provide building specific information and test results. They're incredibly excited about the testing we've done, how widespread the testing is, and how it covers many geographic locations. We're meeting with them again this week to talk through getting over the data that we have now and continuing to send data over to them. They're going to run analytics on that data to understand, are changes needed in the water supplied to the building? Are there certain things in a building that cause water to have different results, test results? And we are very excited about working with EPA closely to assure water quality long term. So I think the last point I'd like to make is not only have we made a difference in the water quality in our buildings, but we're looking to shape water quality industry wide. So excited for that opportunity to partner with EPA. With that, and the updates on the test results, I'm going to turn it over to Brad to talk a little bit about some of the response actions today.
Great. Thank you, Courtney. And thank you, everyone, for joining us this afternoon. We have a really great number of attendees today, looking at about 460 people that joined us. And that's just fantastic that you guys took some time out of your busy schedule to kind of sit here with us and talk about some updates to water quality. Because we know this is really important. It's important to us. You know, we've been working so hard over the last 18 months on this, and we're just really glad that you guys, you know, also see the importance of it. Over that past year, we have gained valuable insight that has allowed us to refine our processes as we move forward to strengthen our water quality practices. And so one key update that we want to highlight today is how our office has enhanced GSA's approach to managing Legionella detection in water systems. So the evolution reflects kind of a deeper understanding informed by some of those industry standards that Courtney was referencing and public health guidance. So GSA has worked closely with federal, state, and local health organizations, as well as industry experts, some of them on the phone and on the call today, to develop proactive and comprehensive water management program. So previously, when GSA detected Legionella in the water system above the GSA established targets, we would take those individual fixtures out of service. However, further research in this expert consultation has shown us this step is generally unnecessary, except in situations where a public health authority imposes water restrictions during a case investigation or an outbreak. And in fact, in a lot of circumstances, it could potentially make the situation worse because you're promoting that stagnation that might have been responsible for the proliferation of that bacteria in the first place. The CDC emphasizes that most healthy individuals exposed to Legionella are not at risk of illness. Legionella test results are best understood and thought about as indicators of system performance rather than direct measures of health risk. And this is often why we use that representative sampling methodology too, because it lets us make those operational adjustments that we've talked about previously. Things like the hot water tank storage tempers, hot water delivery temperatures, chlorine levels, flushing schedules, all those types of things that take into consideration on a system level of what we can do to better move and preserve that water quality within our system. And because Legionella is naturally present in freshwater and relatively common in building water systems, our updated approach focuses on reducing the risk while minimizing unnecessary service disruptions as well. This change has been implemented across all GSA-owned locations starting this Monday. We formally updated our internal guidance, sent out communication to tenant agencies, and provided proper training to our staff. Under the updated approach, water fixtures will remain in service even when Legionella is detected above 1 CFU per milliliter, with clear signage to keep building occupants informed. We'll also go through some of those signage updates in a few minutes. However, corrective actions will continue to be implemented for any location that exceeds that 1 CFU per milliliter to maintain the system performance and occupant safety. We're confident that these updates represent a balanced, evidence-based approach to managing Legionella and helping ensure the safety of building occupants. And we really want to give a big thank you to all the federal agencies that helped us come to this decision and really influence us one way or another. You guys were instrumental in making this happen. Okay, as part of this update, we also updated our temporary bottled water policy. So this allows for greater flexibility in the ability to provide bottled water in situations where a public water system might deem that system as non-potable for a certain amount of time, think like boil water orders, things of that sort, or when test results indicate that there is a problem with water quality that are regulated by the National Primary Drinking Water Regulations. And the National Primary Drinking Water Regulations are what essentially defines potability. And that was what our previous guidance or previous policy for temporary bottled water was linked to. However, we understand there are circumstances such as Legionella being in the system that might have a public health risk that doesn't relate directly to potability. So we also give the flexibility in this updated policy to provide water for those high-risk occupants in situations where there might be public health concerns, such as Legionella in the system, to be able to provide agencies bottled water in these scenarios. So this ensures that bottled water can still be provided for those high-risk individuals in facilities that are experiencing these kind of ongoing concerns. In addition, the update allows for the purchase of disposable cups for water dispensers in areas that are accessible to the public. However, please note that occupant agency and contractors are expected to bring their own reusable cups or bottles for those situations. All right, let's talk about some of this new signage that's being implemented. So as part of this transition, we are also introducing new signage for Legionella, both in English and Spanish, that was developed in conjunction with the CDC to enhance communication and transparency of these situations. For buildings with 30% or greater Legionella distal positivity, it's a kind of a fancy way of just saying, if it was more of a systemic issue, signage will be placed at the impacted point of use outlets like it was previously, building entrances, and common areas. For localized issues, signage will only be posted directly at those impacted outlets. Buildings currently addressing Legionella issues may retain their existing signage for now, but updates will be made when future sampling events take place, like a resampling. So you might see a mixture of signage for the next few weeks while those additional sampling events are happening, but those signage should be updated shortly. And these measures kind of ensure clear and consistent communication to protect the health and safety of building occupants. So this is the first sign in English for Legionella. I'll give you guys a second to kind of read through it. And here is the Spanish version. All right. We've also made slight modifications to the signage that will be used if there are exceedances for lead, copper, total coliforms, or E. coli that are above the GSA action levels in both English and Spanish again. So let's take a look at these updated signage. And then the one in Spanish. All right, great. At this point, I will pass it over to Courtney to help reemphasize some communication updates that we previously talked about, but we just want to make sure we hit home with this one, and then some next steps and wrap up. So again, I appreciate all of you being here today, and I will circle back during Q&A. Thank you.
Great. Thank you, Brad. Everyone hear me? So I wanted to get into some updates on messaging. If you had attended our last client enrichment series, you may remember that we did review our established notification process around our baseline water testing initiative. This process is tied to GSA's drinking water quality management policy, and it's also in accordance with PBS's risk management notification policy and 29 CFR 1960, which addresses the procedures and requirements of the Occupational Safety and Health Program for federal employees. We have recently updated this notification process by removing what we had previously referred to as the interim message. This message was intended to be sent within 1 business day of GSA's receipt of positive results, and those would have come from our O&M, our operations and maintenance contractor, or our lessor in a leased facility. And it was primarily designed to provide initial awareness around exceedances. The body of the message conveyed that preliminary results indicate there is an issue and that we would be following up with more information in a few days' time. During that time, we would fully analyze the results with our regional industrial hygienist community and then put together a thorough corrective action plan. We decided to remove the interim message following feedback from the CDC and you, our customers, indicating that the lack of detailed information in the interim message led to confusion and, in some cases, unnecessary alarm for our occupants. We're now going to be moving right to the official notification, which is to be sent within 3 business days of our receipt of results. This timeline is still very much in line with OSHA notification requirements, and it provides more detailed information about exceedances for all of those impacted. In addition, we have made some updates to the official notification to include the following. First off, GSA building managers and lease administration managers don't have the email addresses for every single occupant in our building. So we rely on our agency points of contact to distribute those to their counterparts within their customer agency. The updated notification does now specifically request or remind those POCs that they please share that notification with their counterparts within 24 hours. We've also now included some enhanced detail about the type and location of the exceedant. So whether it was lead, copper, Legionella, E. coli, where specifically in the building, whether it was a drinking water fountain on whichever particular floor, et cetera, about those exceedances, as well as any corrective actions that are likely currently underway, as well as those that we're going to be embarking on in the future. There's also now more detailed information about Legionella, including links to the CDC's website, as well as an embedded link to our new Water Quality Management 101 video, which you've heard us reference and we're going to watch here in a little bit. And this video features Dr. Stout and Dr. Colum, who have joined us today. Next up, we do have a series of frequently asked questions that we've collected over the last 10 months that we've been undergoing this effort, all coming from our customer community. Once those are finalized, which should be within the next week or two, those are also going to be linked in the message, and they're going to be on the website, which I'll talk about in a little bit. Next slide. So at this point, I'm just going to quickly walk you through an example of the updated notification process following an exceedance. What you see on the screen now is the process that we used to follow. The column of notifications on the left are all of the notification that comes prior to the test happening, letting you know the date of the test. There's a reminder of the date of the test, and that includes information about the status of the building. You may see fixtures out of service, contractors in and out of the building, etc. So those go out. Then within, I don't know, 10 days to 2 weeks, we should receive any indication if there was an exceedance. So that's that gray box that says preliminary results received. We'll follow the path of the Legionella exceedance. And previously, if there was, for example, a Legionella exceedance, sorry, we kind of skipped right ahead, but it used to go to the remediation notice, which now has the big red X on it. And we actually now just, there we go. So that's what it used to be within 1 business day of receiving the results. Now, if you click it, it skips right up to the official notification, which includes all of that great, more robust information that I just walked you through. And that's received within 3 business days. And that's when we kick off our corrective action. So, and then, there's the happy path that if it's all clear, we just skip right to our all clear message. So that's the updated process. And I will just reiterate that per our GSA's drinking water quality management policy, our risk management notification policy, and 29 CFR 1960, we are required to notify at the tenant level, i.e. our building occupants, within specific timeframes. This effort is led by our local building managers and lease administration managers. We have recently removed the interim notice per our customer and CDC feedback, and we are now just moving straight to that official notice that will be sent within 3 business days after we've received preliminary results. That includes the update on notifications. We want to go to the next slide. I think we're jumping into Q&A. So Eric, I will turn that back to you.
Thank you. And yes, we've gotten quite a few questions in addition to ones we already had coming into the session. So I'm going to try and break them up a little bit between now and the last one into some more 101 level and some more 201 level here. So I would just say if these are kind of specific to GSA, Brad, Courtney, feel free to jump on in if they're more about science and Legionella, the Dr. Stout and Column, that's kind of your territory here. But we'll start with kind of a basic question we got in here. Can you talk a little bit of what is baseline testing for water quality and why is it important?
Yeah, I can take that one. Absolutely. This is a good question just to kind of start us right off. So basically, the baseline testing allows us to determine what the current condition of the system is and make those operational adjustments that we were talking about previously. And this is not something that's very common in industry, even in high-risk facilities, but we thought it was very important, especially with kind of some of the trends that we were seeing and some of the information that was coming down the pipeline. And so this lets us look at certain characteristics, certain parameters that are typically found in water, heavy metals, bacteria, and lets us make decisions about further water quality updates that we can implement as part of our policies and procedures to improve the quality of the water. And yeah, we think it's really important, and that's why we're here and we're excited about it.
So, Brad, you said in the course of your answer that it's not necessarily common. Can you talk a little bit more about that? I mean, is it not common in the government? Is it not common in large scale building portfolios? Is this, is what GSA is doing more unique than what the other real estate sector might be doing?
Yeah, maybe I'll pass it over to Dr. Stout or Dr. Cullum. They have experience in a lot of different industries and can probably comment on kind of what the frequency is or if it's a common practice.
How about if I jump on that one? Hi, everybody. I'm Dr. Janet Stout. And as during my introduction, I'm an infectious disease microbiologist, and I've spent my entire career studying Legionella. So almost everything that we've learned about Legionella has come from healthcare facilities, including how to sample, where to sample, how to interpret results. And the reason for that is that people that are hospitalized already have underlying health conditions that make them at risk for any number of infections, including Legionella. And so that's the reason and where most of what we've learned comes from. So now it's being carried over into other buildings. And it was mentioned earlier, ASHRAE Standard 188, back in 2010 or so, I think, was the first time it was published for any building with different types of water systems, cooling towers, evaporative cooling, water distribution, for any building of certain characteristics and population. So that's where all of this comes from. And it's proved very successful at managing Legionella. And for that reason, we're very excited for GSA's efforts.
Great, thank you. We have a question here. I guess it's about our methodology, maybe. So, why is GSA conducting representative sampling instead of testing every outlet in a building? And how does this approach to compare to practices in other industries, like you mentioned hospitals earlier, Dr. Stout?
Right. So what we learned by doing lots and lots of testing in hospitals is that this approach of representative sampling, so what that means is different floors, different wings, was successful in basically answering the two major questions that we're asking when we do sampling. Number one, is Legionella present? And number two, what type of Legionella is present and how extensive is it in the building? And that's where that 30% metric came from. So we use that as a benchmark to sort of tell us that Legionella is growing or not growing in our building water systems. And so that representative sampling answers those questions, and it's unnecessary to sample every location to get the answers to move forward with water management.
All right, thank you. Speaking of every location, someone who has been paying attention asked this question: why is GSA not testing the toilets? Can Legionnaire's disease be contracted from water during flushing?
Why don't we let Dr. Cullum take that one?
Sure.
Yeah. So Legionnaire's disease, or Legionella, I guess, prefers growth in warm water conditions and must be inhaled or aerosolized in order for infection to occur. Because toilets use cold water, and because the aerosolization or the exposure that happens there is relatively minimal compared to something like being right next to a cooling tower or right next to a decorative water feature that's creating a lot of aerosols, there's very little risk to actually mitigate there. So testing efforts are sort of better served where you're focusing on locations where there is more risk for Legionella exposure and infection, like the hot water system, decorative water features, cooling towers, or showers.
And I'll just add a little bit more to that one too. And there are quite a few industry standard guidance for routine sampling, and urinals and toilets are not included in those guidance for Legionella. And even according to the AIHA, which is the American Industrial Hygiene Association, even when a public health authority imposes one of those water restrictions during a cluster or outbreak investigation, toilets and urinals still may remain in service, as neither of those have been shown to transmit Legionnaire's disease.
All right, thank you. We do have actually a couple other questions about Legionella coming in. I'll ask two in a row kind of here. So one is, it's basic, what is Legionella? And Dr. Collum, I know you gave a brief kind of primer on that. And then someone else asked if Legionella bacteria, is it commonly found in building water systems? Is it uncommon? And have studies been conducted on what types of buildings it's more common in? Is it office buildings, churches, schools, homes?
How about if I take that one?
You are the expert. Please do.
Okay. So Legionella is a naturally occurring bacteria in water, and it is in lakes and rivers and eventually makes its way into our buildings where there can be conditions where Legionella can grow. Most of us have been exposed to Legionella in our lifetime. And the reason I can say that with confidence, both our studies and others have shown, somewhere around 50% of hospitals will test positive for Legionella. Same for commercial office building high rises. It might surprise you to know that Legionella has also been found in residential homes, depending on the study, anywhere from 10 to 40% of those single family dwellings could have Legionella in them. And then, of course, cooling towers that are tested, about 30% of those that we test are positive. So the idea here is that we've been living alongside this bacteria pretty much all of our lives, being exposed to it without any ill effect. And that's true for many, many different types of bacteria that are in our water.
All right, thank you. So I guess a natural follow-up, just as a building occupant and person, if Legionella is commonly found in the building water systems, even in our residences, why aren't there more widespread cases of Legionnaires' disease?
Well, that's a great question. And the reason it's a great question is that's what we're all thinking. Well, if I'm exposed to Legionella, how come I don't get Legionnaire's disease or somebody I know? And the reason that this disease is rare is that multiple factors have to come together just the right way and just the right time in order for illness to result. And the majority of the time, our exposure does not result in illness. And so is it a strain of Legionella that's most likely to cause illness? Has it gotten from the water into our lungs? And the people who are exposed, are they in certain health risk groups? When all of these things happen in just the right sequence, then they might go on to develop illness. But I think it's important for everybody to know that the disease is rare. Only about 2 to 5% of all community-acquired pneumonias are Legionnaire's disease.
Thank you. So kind of someone's asking this question, and it goes with the theme of what you just said. So if Legionella was detected in a building's water system, they're asking, is it the result of low occupancy or low usage, or was it likely that it was present for a long time without being causing any ill effects or even being noticed?
Dr. Collum, would you like to take this one?
Yeah, of course. Briefly, that sort of latter statement is probably the more correct one, that this is a bacteria that's kind of just part of our natural drinking water microbiome. These factors like stagnation and that were sort of exacerbated by the pandemic and occupancy can also exacerbate the growth of Legionella within a system. But even in buildings that have a lot of water use, that are doing everything correctly in terms of water temperature and circulation, you could still find Legionella because it's just a part of the sort of natural group of bacteria that we find in our drinking water often. So largely, yes, it is just something that is, been a part of our buildings since they've been constructed, largely without ill effect.
All right. So if GSA is testing for Legionella and we're finding Legionella in our buildings, that doesn't necessarily mean that there's an increase in Legionella this year versus 10 years ago. We're just testing for it and looking for it, and it's there. I mean, it's kind of an oversimplification, but some people are hinting at that in the question that I got. Is that fairly accurate? That
Yeah, I would say
we're finding increases because we're looking for them?
yes, I would say that's absolutely correct. GSA probably has a better sense of what Legionella looks like within their building portfolio than, you know, any other set of buildings throughout the country, maybe except for, a large hospital network, which is one of the reasons why Dr. Stout and I are pretty excited to be here today, because this is really sort of advancing the ball in terms of water quality management.
Great, thank you. A question back to Legionnaires, and someone wants to know, what are the risk of contracting Legionnaires from various potable water fixtures, your specific fixtures? We talked, I think, about toilets a moment ago, but showers, drinking fountains, kitchen sinks, bathroom sinks, things like that.
I guess I'll take that one. It's an interesting question after all these years of study. It's very difficult to parse out exactly how the exposure occurred or which type of fixture, aside from these big community outbreaks that are linked back to mismanaged cooling towers. So, for example, there was one study in a hospital where they compared people that got Legionnaire's disease versus those that didn't, and whether they showered or not. And one of the interesting findings of that is that the people that got Legionnaire's disease didn't shower. And it was because they were too sick to shower. So they obviously were exposed a different way. So, the overall message I really want to make sure people understand is that even if Legionella is present, the risk of illness is extraordinarily small.
All right, no, thank you. That's very helpful. We'll do one more and then we can move on back to Legionella. So what are some of the major growth factors that allow Legionella to thrive? And more importantly, what are some best practices to keep the situation under control?
Take that one, Dr. Collum.
Yeah, of course. So Legionella prefers to grow in warm water. So if the water is sufficiently hot, it stops growing and eventually will start to die. But if something is more in the sort of tepid realm, like, it's a pathogen, it kind of likes something around our body temperature, that's where it can really grow quite a bit. And then when water is stagnant, when it's not flowing through the system, that also gives Legionella a nice opportunity to sort of multiply in the bulk water. So to control its growth, we use water management approaches and engineering controls, like keeping the hot water at a sufficient temperature to minimize the growth of Legionella in those building water systems.
Great, thank you. Just a quick time check. We're about halfway through our allotted time, so I'm going to turn the presentation back over to our OFM team to get to website and the new video and some next steps, and I'll come back for some more Q&A in a bit.
Great. I think it's back to me with the website update. So we can go to the next slide. Hopefully many of you are already aware of our water quality website. It's at www.gsa.gov/water quality. And it's a really great one-stop shop for an overview and updates on our water quality management program, as well as a trove of additional water quality and safety resources, which we've collected from our partner agencies such as the CDC, EPA, OSHA, and ASHRAE, as well as our valued industry partners and experts, Dr. Stout and Dr. Cullum. Some recent updates on the website include the embedded video, which we've been talking about, GSA Water Quality Management 101. We're going to watch it right after this slide. We also have updated information around when we expect to see lab results. Initially, we expected most lab results within 30 days, and that was based on our experience. Due to the high volume of testing that GSA has created itself, laboratories are beginning to experience some delays, which has affected that timeline. So final reports will be available once our contractor receives all of the results and they can compile those deliverables. I am going to go ahead and address a question that I saw come in around the provision of results. So when we get notification, it comes in two ways. And the first is what we consider to be the initial lab results or preliminary raw lab data that indicates we've done the testing and we see that there are exceedances of these different parameters. And here's this information. That raw lab data is not always very easy to decipher. I personally have seen a lot of these results come in, and from time to time, I have to look really closely at that information to understand what it's telling me. Because of that, we are not linking that raw lab data to our official notification at the onset. What we have encouraged for agencies is that if they have individuals such as industrial hygienists on staff, health and safety officers, facility management folks who are a little more well-versed in looking at that data and providing context, that we would prefer to share the information or funnel it through them. So that's why those initial lab results aren't always shared immediately, but they can be, and it's really just a matter of working with your local building manager or land to get those provided. What we are committed to sending is at the end of the entire testing process, we do receive a full lab report with all of the associated deliverables and data from all of the different tests that were performed. That is sent along with the final notification message. So you will be getting that. That does get distributed to all occupants. So thank you for that little aside. I'm going to skip ahead to go back to the website. We have also updated our language around corrective actions so that they're now consistent with not taking those fixtures that test positive for Legionella out of service, such as Brad just covered. We've also removed some outdated information. For example, we had a fact sheet that was created at the very, very, very onset of all of this that, a lot of information in there has changed, as well as some of our long-term considerations, which we had initially laid out prior to having the benefit of robust test results to guide us. And I'm actually going to talk about what our new long-term strategy looks like. Lastly, we do have some other helpful workflow and navigation changes based on some heat map analytics of the website usage. So hopefully it's just we continue to update that. I highly recommend you check it out on a regular basis because we do try to update that as much as possible to give you the most up-to-date information. At this point, we're going to watch the Water Quality Management 101 video, and I think, Brad, you're going to go ahead and click that link for us.
Welcome to this webinar on GSA's water management program. I am Dr. Janet Stout. I'm an infectious disease microbiologist, and I've studied Legionella my entire career, over 40 years. Sometimes what I think that means is that I'm no longer an infectious disease microbiologist, but actually a Legionellologist. Yes, I made that up, but it adequately describes my career. And what that means to you is that I'm an expert in the detection, control, and prevention of Legionella and Legionnaire's disease.
And I'm Dr. Abraham Cullum. I'm the Director of Water Safety and Management at Pace Analytical, and I'm an expert in in-building plumbing microbiology and safety.
You know now that GSA has been doing a lot of testing of buildings, and you might be thinking, well, there must be a problem if they're doing all of that testing. And actually, it's the opposite. What the water quality and management team is doing is testing to determine overall water quality and taking efforts to improve and maintain that water quality. So testing does not really imply that there's a risk. It means that GSA is working towards improving water quality. So what does that mean exactly in terms of what is water quality management? So this slide sort of defines what water quality management is: reducing the presence of certain metals in water and certain bacteria like Legionella bacteria and some other bacteria that are water quality indicators like coliforms. So you'll see the word proactive, and I applaud GSA for doing this proactive program that includes testing for Legionella. So the proactive strategy promotes the safety of the people who occupy GSA buildings. So you might think promoting safety means that the buildings are unsafe, and actually that's not true. The testing provides baseline monitoring to go forward to define what corrective actions will be taken to keep Legionella and these other metals and indicators under control. So what is Legionella? Legionella is the bacteria that causes a form of pneumonia called Legionnaire's disease. And it might surprise you to learn that this bacteria is actually common in our building water systems. And so this slide is broken down into different types of buildings: hospitals, large high-rise buildings, even homes, and then of course cooling towers. So the bars represent the minimum and maximum percentage of those types of buildings that have been found to be positive in surveys or studies that have been performed. So in terms of hospitals, anywhere between 12 and 70% have been found to have Legionella bacteria in the water. And in terms of high rises, up to 60%. And again, it might surprise you to know that even your own home could have Legionella, and studies that have been done show anywhere between 10 and 40% of residences could have Legionella. And then finally, cooling towers. And so lots of outbreaks of Legionnaire's disease have been associated with cooling towers, but not all cooling towers have been tested positive for Legionella, actually between 30 and 50%. So the rule of thumb is that about 50% of buildings that are tested for Legionella will show some amount of Legionella in those building water systems. What makes Legionella grow in these building water systems? And so Legionella comes into our buildings in basically undetectable amounts from the cold water from the municipal treatment plant. These three factors are what are necessary for Legionella to grow within our building water systems if it's there. Probably the most important thing is temperature, and think about temperature around body temperature, around 100 degrees, as optimal for Legionella to grow. And then it also needs nutrients, and our building water systems provide abundant nutrients. Think about the scale and sediment that are in our pipes. And then finally, other microbes, other bacteria, even protozoa that are naturally in our water, like Legionella, can help Legionella to grow. So these three factors have to be together in the right way in order for Legionella to grow within our building water systems. Similarly, there are also three factors that are necessary for Legionnaire's disease to occur after exposure to the bacteria. And one of the most important things for you to remember from this presentation is that Legionnaire's disease is actually rare. Only about 2 to 5% of the pneumonias that occur in the community are caused by Legionella. And the reason it's so rare is that these three factors don't come together in just the right way or time very often. So the first factor is there Legionella bacteria in the water, and of the type that can cause Legionnaire's disease, because not all Legionella do? Can it get from the water into the lungs? And probably most importantly, is it the lungs of a susceptible individual? And people that are more susceptible to going on to develop Legionnaire's disease after being exposed have underlying health conditions, the most extreme of which would be transplant recipient because they're receiving medication to suppress their immune system, other immune compromising conditions that require high dose corticosteroids, diabetes, being elderly. These are the health factors that once exposed could, not very often, remember, go on to develop Legionnaire's disease. So as I said, about half of the buildings that are tested are going to have the presence of Legionella. So what that means is most of our buildings have had Legionella in them, even since they were first constructed, without any ill effect. So that means that these buildings, the GSA buildings, other buildings, are not unsafe, but Legionella could be present, and that the presence of Legionella needs to be managed. And that is done through water management. And the goal of water management is to ensure that the amount of Legionella in the building water system or metals stays within acceptable limits. So I always say, think about Legionella as the pot on the stove, and our control efforts are the lid on the pot. And as long as we are controlling the growth, our water is perfectly fine, and I would be happy to drink any of the water in any of the GSA buildings.
One question I often hear is, why are we testing everywhere? Well, testing every single outlet within a building isn't necessary. So first of all, this process is meant to not disrupt the daily routine of building occupants or those within these buildings. So when testing begins, there will be designated areas within the GSA buildings that certified contractors will evaluate and then collect samples from to assess. But more importantly, testing every single outlet is simply not necessary to understand Legionella growth within a building. So a representative set of samples tells us all we need to know about the growth of Legionella within a building. On the day of testing, contractors perform their assessments in these designated areas with posted signage on the outlets. Do not use the water devices in these closed off areas or with this posted signage. However, you can continue to use water where testing is not occurring. And then once results are received, building occupants will receive an update and any necessary next steps. So results will be received in approximately 30 days. Testing will continue until acceptable levels have been maintained. In cases where elevated levels are detected, GSA's water quality management team will implement its corrective action plans to ensure immediate response and follow-up testing to verify the effectiveness of those actions. Corrective actions might include flushing, adjusting water temperatures, or implementing building modifications such as replacing pipes and fixtures. While corrective actions are underway, temporary measures may be necessary to ensure potable water is still available. GSA has a lot of buildings, so there's a lot of testing going on, and you can expect to see more of me as we continue to support the water quality management team with its risk assessment and answer your questions. And if you're looking for more information on water quality management, visit gsa.gov/water quality.
Okay, that was a wonderful video. And just to reiterate, this video is now embedded into our official notification when it goes out around Legionella exceedances. It's also embedded on our website. It's a YouTube link. So I know that in a lot of scenarios, this has been shared far and wide with our customer agency organization. So you can access it many, many different ways. So before we get back into some more questions, I wanted to talk a little bit about our next steps, particularly regarding how, following the results of this baseline testing, we intend to manage water quality in our buildings well into the future. So one of the first things that we've always been wanting to do, and we will be moving toward, is monthly Legionella testing. This will be Legionella testing for cooling towers, decorative fountains, humidifiers, misters, and other types of unique water features on a monthly basis during the months that they are in operation. This is not to say that GSA has not tested for Legionella in cooling towers previously. Our prior requirement expected that there would be a quarterly bacteria testing performed, which simply indicates that a bacteria dip test would happen. If those bacteria levels indicated that there was a concern, we would then move to the Legionella testing. We're moving beyond all of that and just going straight to monthly Legionella testing. And this will be solidified through modification into our O&M contracts, operations and maintenance contracts. Next up, you heard us talk a lot about ASHRAE and ASHRAE 188. ASHRAE stands for the American Society of Heating, Refrigerating, and Air Conditioning Engineers. These ASHRAE 188 water management plans are considered to be the gold standard in water management, and they are required for hospitals and long-term care centers that are funded by Medicare and Medicaid services. GSA, in the long run, plans to apply this baseline criteria for ASHRAE 188 plans, meaning that any of our buildings that are more than 10 stories high, and this includes any levels that are below grade, will be getting an ASHRAE 188 plan. But we're not stopping there. Many of you who may already be in a facility that had the results of baseline testing indicate that the building could benefit from a 188 plan, has probably already heard that that is in the process at your facility, whether it's 10 stories high or not. In addition to that, certain criteria such as square footage may also be taken into consideration as we move towards establishing that baseline need for the ASHRAE 188 water management plan. Then lastly, we're looking at flushing and technology solutions. So we will be continuing to pursue weekly flushing of our childcare centers. This is particularly because the young occupants of those facilities are at risk for heavy metals, and flushing is the best way to proactively treat water for that. So we'll be doing weekly flushing there. We're also exploring technology around flushing and monitoring. So that means we're looking at automatic flushing valves for our risers and distal outlets, and also looking at hot water temperature and residual chlorine monitoring throughout our facilities. And then lastly, we have an industry day coming up in the near future. And we really just want industry to come let us know what they have to offer in this realm to assist us with continuing to circulate that healthy treated water through our facilities. Some of this will be subject to change as we continue to fine tune our strategy. This is based on our experience that we keep getting results in every day, and we're learning every day, as well as the expert guidance that we've been getting along the way. We aim to finalize all updates to the water quality management policy and our long-term strategy in early 2025. And as always, we'll continue to be transparent and share that information with you regarding our next steps. So that's a little sneak peek about what Client Enrichment Series session number 4 around water quality management will likely include. So in conclusion, I'm going to turn it back over to Eric, who's going to close us out with some more Q&A. Thank you.
All right. Thank you very much, Courtney, for that. And yes, please do continue to submit questions in the Q&A pod. Looking at the clock and looking at the volume, we will not be able to get nearly to all of the questions, but we do want to hear them so that we can review them and then we can address them in future presentations, future things up on the website that we just talked about. We got a few questions from our earlier conversation about fixtures remaining in service. And I think we talked a little bit about this. I think it's worth reiterating. If Legionella is found in the water, can fixtures still be used? And if so, why is that acceptable? It seems counterintuitive. So this may have come in before we talked a little bit about it, but I think it's important to kind of reiterate that revision to our process.
I can sort of start out there. So the closure of fixtures sort of went beyond industry sort of guidance here and even CDC recommendations in this area. We know that Legionella is very common in the environment, and so finding it out an outlet simply just doesn't really show that there is a sufficient risk of infection out that outlet. This is something that has been not just in GSA buildings, but in, if we think probably about 50% of all large buildings in our country for a very long time. Still, infections are extremely rare. So finding Legionella at an outlet does not mean that that outlet is unsafe to use. So making this change is sort of bringing the response more in line with what industry guidelines, CDC recommendations, and our best understanding what risk is from the science.
I think a follow-up to that is there a maximum concentration of Legionella at which it becomes unacceptable to continue to use a fixture?
There has.
How do I take that one? So first off, whenever these values, these concentrations of Legionella reported, and there are exceedances, it's really important to reemphasize that the exceedance it's above a somewhat arbitrary set point that's made to sort of indicate whether Legionella is growing within a system or not. Those exceedances are not about whether water is safe or not. And in fact, there's never been a scientific correlation made between any concentration and ultimately getting Legionnaire's disease. So it's important to recognize that. So there's sort of targets that are set to help us with water management. And this is why Brad said earlier, they are performance-based targets, not health-based targets. So, how well is Legionella growing or not growing within a building? Performance, and not an indicator of whether or not Legionnaire's disease is going to occur. So concentrations don't predict, regardless of the concentration. So it may surprise you all to know that in terms of the bacteria in our buildings, there's hundreds of thousands of bacteria, just like there are on our skin. So we don't eliminate them. We sort of live side by side with them without ill effect.
Thank you. In the same vein of what you just said and talking about these fixtures, someone asked a very simple question. Are buildings or spaces with elevated levels of Legionella safe to occupy?
Yes.
Okay. And everything that I have heard you say and on that video up to this point supports that. So I think that was kind of important just to state that very simple question. It feels like a closer question, but we've got some more to go here.
Yeah, and I understand the question because people think, when they think about Legionella, they think about those outbreaks that are, in the newspaper over these many years. And so they think that its presence means danger. And I understand that. But now, what GSA is trying to do is educate everyone about, sort of the basic microbiology of Legionella in our building water systems, to help you understand that we've been living alongside Legionella pretty much all our lives.
And Eric, just to add a little bit more detail to that, this is common practice in hospital environments too, where they are treating and having overnight stays of those high-risk populations on a normal basis. And that's what those centers are designed to do. And those types of facilities do regularly test their water for Legionella because it is a greater concern. And it's normal to find Legionella even in hospital water systems, and they do not stop treating patients or anything like that. Do they not turn off water? If there's a very high risk area, maybe a burn unit, something like that, or a chemotherapy unit, they would look at installing filters, but they still leave those fixtures in operation and they still keep that hospital in operation. And GSA does not operate any sort of facility like that.
No, I think that's very important context. So thank you. This next question says the CDC guidelines state that concentrations of Legionella in a drinking water system are performance indicators rather than direct measures of risk to human illness. What does this mean, and how does it relate to the rationale for allowing fixtures to remain in service?
I think we just covered that, Eric.
So I think we just did too, as I read it out loud. Okay. Dr. Stout, I heard you say, and I think that the incidence of Legionnaire's disease, different obviously than Legionella, is quite rare and quite small. And quite predictably, I think we've gotten some questions about it. So if you don't mind, I would like to kind of ask some of these questions that have come in about Legionnaire's disease. And so let's see, the first one that I think is basically, what are symptoms of what is Legionnaire's disease, and what are the symptoms that people should be aware of?
So Legionnaire's disease is pneumonia caused by the bacteria Legionella. So pneumonia means that a healthcare professional has either done a chest x-ray and diagnosed you with pneumonia, or listened to your lungs and heard fluid in the lungs, which defines pneumonia. Interestingly, the symptoms of Legionnaire's disease are pretty much the same as many respiratory illnesses: high fever, cough, shortness of breath. And because of that, there are no distinguishing features or symptoms that sort of pinpoint this as Legionnaire's disease. And so, if someone is diagnosed with pneumonia, not bronchitis — Legionnaire's disease is not bronchitis, it's pneumonia. If you're diagnosed with pneumonia, this is what I tell everybody, tell the physician, think about Legionella in what they call the differential diagnosis, the list of possible candidates for this pneumonia, test you for Legionella, and treat you with an antibiotic that covers Legionella as well as all the other common bacterial agents. And that would be, if you've ever been on a Z-Pak for a sinus infection, zithromycin is a very effective antibiotic, as well as levofloxacin or ciprofloxacin.
All right, thank you. No, that's very helpful. We have a couple questions relating to folks who may be in high risk categories. So I want to know, should all persons who are in high risk categories be equally concerned about developing or contracting Legionnaire's disease, and or what are some steps that people can take to reduce the chances of the exposure to the disease or contracting the disease?
Right. So if you have underlying health conditions, that we've talked about, the most at risk would be transplant patients, high dose corticosteroids for chronic lung disease, cancer chemotherapy. These are conditions that increase risk of infection of all kinds, Legionella among them. So it increases the chance of COVID, increases the chance of influenza. So you don't really behave differently. You just know that there is potential for exposure. And again, if you would be diagnosed with pneumonia, ask for a Legionella diagnostic test and to be covered with an antibiotic that would cover Legionella, and you'll do fine. So I understand why it would be. It's like you have information, and you can either sort of be more worried about it, or just sort of, I'm going to deal with it should something happen. You can always talk to your healthcare provider if you are severely immunocompromised about whether you want to take any additional precautions.
Great. On the topic of Legionnaire's disease, how are confirmed cases of Legionnaire's disease reported? And so how would a public health department identify the source of the infection? I think this is something we're all familiar with from a few years ago in terms of contact tracing and things like that. Is there similar reporting and tracing with Legionnaire's disease?
Yes. So it's mandated by law in almost every state that any diagnosis of Legionnaire's disease must be reported to the health department. And the reason is, they want to be ahead if there's like some large outbreak like happened in the Bronx in 2015. So it's mandated to be reported. And we hear all the time about food related outbreaks and how they're doing all the science to link the E. coli, for example, in the food or the hamburger to cases of gastroenteritis. Well, it's similar with Legionella. The health department gets involved, finds out if there's a common source of exposure, tests that location, and sees whether or not the Legionella from that suspected source matches what's infecting people. So it's a very important role for public health authorities.
Great, thank you. Both you and Dr. Collum talked about some of the remediation for Legionella, that it's temperature-based and some other things. But someone mentioned something about supplemental disinfection systems. Is that something that we could look into? Why don't we just install these supplemental disinfection systems?
Dr. Collum, you want to take that one?
Yeah. So these supplemental disinfection systems operate by adding a small and safe dose of a disinfectant. It might be one like the one the utility provides, like free chlorine or chloramine, into the water that circulates throughout the building, sort of helps keep Legionella levels down. These can be a very effective means of reducing Legionella levels, but there are sort of two key hurdles to sort of implementing them, or at least things you want to consider. One is that these can have adverse effects on the rest of the plumbing system. So they require quite a bit of additional monitoring in order to sort of implement well. But more importantly, if there are some sort of underlying conditions to the building that are allowing for excessive Legionella growth, if you don't correct those, a supplemental disinfection system probably isn't going to help that much. If there is an area of the building that's stagnant, you can add as much chlorine as you want at the entry of the building, but that's going to decay and not really reach that part of the piping anyway. So sort of correcting those sort of fundamentals of the building water quality and the hydraulics are a really essential sort of first step.
Yeah, and just to add a little bit to that, there's a lot of regulatory complexity that comes into play too. So you essentially become a public water system if you install one of these systems, because rightfully so, you're adding a chemical into your water, and that could potentially have harmful effects on the building occupants. So we just want to make sure that we're balancing any of those systems if it does come to a point where something like that needs to be installed. But we make sure that we have a hierarchy of controls to make sure we're implementing all of the things that Dr. Stout and Dr. Cullum are talking about first, to keep that lid on the pot, instead of jumping to something kind of drastic and extreme like that. And, you know, if there's a case of a case investigation or an outbreak, that might be something that the public health authority demands that we implement, but it's not the first step in the process typically of what we would look for remediation steps.
All right, great. Thank you. Someone is asking why we aren't testing the air for Legionella, and noting, is there a risk of Legionella spreading from cooling towers? I know Courtney Hatchell spoke to this in our next steps, but why don't we test air for Legionella?
I can take this one. So it's a logical question because we breathe in Legionella bacteria, but over all these years, when people have tried to do air testing of the air, the methodology isn't very good. And so you don't really get much good information or accurate information. The second thing is that we know that Legionella is in the water. So more directly, we test the water for Legionella, and then you know, sort of focus our attention on managing Legionella in water. Even with cooling towers, where the aerosol or drift comes off the tower, we test the water, and if we keep Legionella under control in the water, we basically don't have to worry about the drift.
All right, great. Thank you. Spent a lot of time on Legionella, but I think, as we've noted, we're also testing for many other things in our baseline water test, including lead, copper, and coliforms, which leads to E. coli. And someone is asking about another remediation type system. What are filters recommended, like water filters? When are filters recommended? So can you recommend that we would put filters on any of our systems to kind of minimize exposure to all of these types of things, not just Legionella, the lead, the copper, and so forth?
You want to take that one, Dr. Cullum?
Yeah. So filters are something that we normally might see in a very extreme instance, like an active case investigation that's occurring in a hospital or someplace that has, you know, a really high concentration of immunocompromised individuals. They can be a good barrier and sort of allow, you know, someplace that has an active outbreak time to sort of figure out other things in their water system. But filters don't correct issues with water temperatures or stagnation in a water system. So, you know, I would never recommend them just to a building that has found Legionella in their water system and they're not having any sort of other issues. They're really for those quite extreme circumstances. And it's important to note, there are many different kinds of filters that are out there. Some that are effective for lead and copper may not be effective for Legionella, and vice versa. So even when implementing these, it's important to sort of know what parameters you're sort of targeting.
Eric, do you mind if I jump in for one question? I see kind of one repeatedly in various different ways, and I was hoping
Go right ahead.
Okay, so one that I kind of see consistently pop up in the Q&A pod is, you know, we're talking about how Legionnaire's disease is pretty rare and not something that's very common. So why is it important to do any of this testing in the first place? Why you guys just kind of continue status quo and not do any testing? And, you know, It's a good question, and it's one that's understandable. And what we're really trying to do is proactively prevent cases of Legionnaire's disease. We're trying to actively manage our water systems and improve upon those operational conditions that we were talking about, so we don't end up in a position where people are getting Legionnaire's disease in our facility. And we feel very passionately and strongly about that scenario. It can be a deadly bacteria, and we want to make sure we're getting ahead of that, and that we're not, potentially sticking our hands in the sand if that's a situation that would arise. And I think, Dr. Stout has a really good quote from one of the public health directors in her area, basically kind of something along those lines, if you don't look, you don't know, and then you don't do anything about it. And that's kind of what we're not trying to do. We're trying to take an active look at these systems and make improvements where possible, develop projects if necessary to better improve the water quality in our facilities, and promote change for other building owners, private building owners, and also from a regulatory standpoint, where much of the focus has been on public water systems that go up to the service delivery line of a facility, but there's really nothing for building owners, including residential building owners of our type, private building owners. And a lot can happen from the service line to the point of use. And that's what we're looking to investigate and improve upon to make sure that the industry is following those proper directions. Dr. Stott, Dr. Cullum, do you have anything to add to that?
I say, well said.
Brad, I also say well said, and I'm looking at the time and I'm thinking that is a great note for us to start winding down our presentation on here. Like I said, I see a number of questions in the Q&A pod, and our apologies that we can't even scratch the surface of all the ones that we wanted to get to. But please do keep popping those questions in. We will review them, and we will use those to inform our future updates to our website and to future presentation materials. So with that said, I do want to extend first my thanks to everybody who is joining us today, all of our customers. We're still well close to 400 persons here. We thank you for your time. We thank you for engaging with us. We thank you for your questions of all types. So thank you for spending the time with us and for continuing to be a great partner with GSA. I also want to thank our presenters today from our Office of Facilities Management, Courtney Springer, Courtney Hatchell, and Brad Short, and our third-party experts from Special Pathogen Laboratories, Dr. Janet Stout and Dr. Abraham Cullum. So thank you all for a great engaging presentation today. As I mentioned, if you are attending or if you registered, you will get some follow-up information from us, including a copy of this slide deck, as well as a link to the recording of today's presentation. So look for that in your inbox shortly after the session concludes later today. Also want to point out that we have several upcoming client enrichment series on a variety of topics. It is listed up on the screen, but we have on Thursday, December 5th, we have a conversation on hybrid work and sustainability. We have RWA policy and process fundamentals. That's coming up in the new year on January 9th. And then the principles of global project management. That is Thursday, January 30th. And you can learn more about each and every one of those at www.gsa.gov/CES, and you can register in advance for all of them there. I'll also point out that we have a YouTube channel where we post all of our recordings, so you can go to that at any time. The link to that will be sent with you in the slide deck today, and you can check out, I think we have more than 40 different presentations. This will be up there, as well as things on design and construction, cost management, leases, any topic of interest to the public building service and our customers. You will find it up there. So one more time, thank you all for joining us. Thank you to our subject matter experts, and I want to thank the CES team behind the scenes. And we'll just note that the goal of our client enrichment series is to engage our audience in workplace topics that contribute to your mission success and to the effective management of your real estate and workplace programs. Thank you once more, and everyone have a great rest of your day.